Hi, it's Mark Bossard. I'm here with Wil Seto of Insync Physio in Vancouver, one of Vancouver's favorite physiotherapists and physiotherapist offices, and we're talking bodies. Today, we're going to talk about back of knee pain from running. How you doing, Will?
I'm doing good, thanks. How about you?
Good. So sometimes you get that back of the knee pain when I used to run. I don't run anymore. I gave up. But what's that from? What can cause that?
Yeah, so one of the most common things, and some of our physios have been treating a few runners that just ran the marathon here. And basically, it's an overuse injury of a particular muscle in the back of the knee. And so the muscle is called the popliteus. So just wanted to give you the name there. And basically, the muscle becomes overused because it's very multifactorial. So it's not just like one. And you look at the loading of training for something like a marathon, and you look at all the loading that happens with the training. And so the popliteus muscle has a couple main functions. Its main function is it flexes the knee and it helps with unlocking the knee joint and preventing the femur, the top of the thigh bone, basically dislocating over the bottom leg. And then the secondary function of this muscle is that it acts to basically hold in place like stability, like it stabilizes the joint on a more static level. So how you usually injure it, like I said, with an overuse, like you can also injure it traumatically, but we're going to talk about more that overuse kind of gradual onset. And like I said, there's multifactorial things going on. And if you have over rotation of your lower leg, and then you add all that load and repetition, then as you look at over time, then that can really be a big factor for that.
So why does overtraining, or how do you even stop this? Or what's the cause of this?
That's a great question. So quite often there would be someone that presented with like some previous injury or a history of an injury before. So in these specific individuals that have come in, two of them have actually had like reconstructive ligament repair, reconstruction of the ACL, which is a major ligament of the knee. And so obviously when you have a surgical procedure like that, you really change the mechanics of your whole knee and your leg. And then they rehabbed and it's been like, I don't know, maybe even like 2 or 3 years since the surgery, but their mechanics is still a little bit off. And then now they're like, oh yeah, I want to run a marathon now. This is my first marathon. I can, test myself. And so if they're not careful, then you can really have these compensations happen. If it's weaker, you have weakness that basically occurs on the one side and you're not fully rehab strong enough and you're not looking at the mechanics of your running. And so essentially with that forced rotation, and then you're getting excessive strain and pull on that popliteus when your foot's in contact on the ground, and then your lower leg is essentially fixed.
So is that the main cause? Is that someone's had reconstructive surgery, or can this happen with other people?
Yeah, no, it can also happen with other type of injuries or even back pain and back stuff where essentially it's the changes in the mechanics of the leg. And when you have that extra rotation for whatever reason, whether it's like an injury or it happens to be that with something like ACL reconstructive surgery, it's a little more dramatic. And so what happens there, then you really got to go through the rehab process to be able to have a proper normalization of the movement in that knee in terms of mobility, but also the strength and the coordination of all the muscles around there. And so that's the main reason.
So how do you go about diagnosing it when someone comes in?
Yeah, so there's different stages of it, and we get runners that come in, or even like from running sports, like ultimate football, soccer, and all that stuff, where you get pain over the sort of back outside of the knee, and it can be sometimes even just be painful, like standing on it, going upstairs, and the range of motion is usually incomplete, like you're lacking range, and there could be even swelling, and people usually have pain in that area.
And so does the course of treatment include like working on their biomechanics so they're not flexing or twisting in the wrong way that their body can't adjust to?
Yeah, 100%. And it's so crucial to be able to correct the maladaptive movement pattern because if we just settle down the muscle overuse aspect of it, then it doesn't necessarily fix the cause of it and how it all started. And then the other thing to really note too, like when people come in with this, they're usually more concerned about like bigger things going on, and it's valid, right? Because there could be other stuff going on that's legit because it's in that area where, oh, maybe there's like a hamstring strain or like a meniscal injury, which is basically the cushiony part of the knee, or ligament injury or something like that. And so people come in usually, being quite surprised when we assess their knee, and one of our physios says, well, it's actually, your ligaments are fine, and you actually have an overuse in this muscle, and you never even heard of the muscle before. It's like, oh, popliteus. It's like, you know, the first time you even heard of that word or that name of that muscle. So sort of an awareness to that too.
What's the recovery time look like?
Recovery times can be really good depending on how aggravated, like how bad it is, I guess. So you can have it where it's like super inflamed and you got to let it settle down first. So there's going to be like a good few days where if it's swollen. So if you have pain just standing and walking and climbing stairs, then it's probably a little bit angry at you. So you gotta let it settle down a little bit. And so that period, in terms of like, oh, okay, doesn't hurt with walking anymore. Then you look at, well, then what's the gradual progression? Get back to like now doing a little bit more. And so typical time frame is, we usually get runners back depending on how serious it is, but within like a couple weeks. But the key is really unloading. So with these runners, they're doing like pretty heavy mileage per week. Or even if you're just recreationally running, like as you decrease the mileage, now you're just doing 3-in-1s for 5 sets. That's significantly less than, 50 kilometers per week kind of thing. So decreasing the load is key too in the first stage. And typically it takes about 4 to 6 weeks to fully recover, to really work out that biomechanics of everything and making sure that the movement patterns are good in your hip, and also what's going on in the back and how your core strength is activating. That way you're not over rotating when you're making contact on the ground, when you're heel striking and pushing through, and you're not getting into that extreme range and aggravating again.
If you're having some back of the knee pain, the guys to see in Vancouver are Insync Physio. You can book online at insyncphysio.com, or you can call the Vancouver office, 604-566-9716. They also have a North Burnaby office, 604-298-4878. You can book either place online at insyncphysio.com. Thanks so much for watching and listening. We appreciate it. Thanks, Will.
Thanks, Mark.